Alright guys, welcome back. Today we are breaking down exactly how to take history in Fact 2, clear, simple and examiner friendly. If you follow this structure, you will never get lost in station again. So this history taking is basic history taking. When there's gynecological history or surgical history, you can add few things in this structure, but we will discuss that in another video. Let's start with the basics. It includes Oddipara and Socrates. Remember these two mnemonics because they are really important. So what does Socrates stand for and when to use it? Socrates, we use it when the patient main complaint is pain. So when there is pain, you have to ask Socrates. So Socrates include site, where exactly is the pain, onset, when did it started, character. You will ask the patient, can you please tell me, how does the pain feel like? Is it stabbing pain? Is it chopping pain? There are multiple type of characters that you can ask. Ask about gradation. Does it go anywhere else? Associated symptoms with it. Relieving and aggravating factors. Timing and severity. These are really important steps that you have to remember. After that, you have to ask about Oddipara. We use Oddipara for all the other symptoms such as cough, diarrhea, shortness of breath, dizziness, any non-pain thing. It includes onset, duration, intensity, progression, aggravating, relieving factor, and associated symptoms. Alright? So, to make it simple, for pain, you have Socrates. Any other symptoms, you have to ask the Oddipara. Once you understand the main complaint, the next step is differential. Now you might have some differentials in your mind. Don't ask them randomly. Ask targeted screening questions only. For example, any chest pain or shortness of breath. So use your clinical brain to rule things in and out. Alright? Next comes red flags. Never skip this. Examiner is watching especially for this step. So there are some conditions in which you have to ask specific red flags, but even if you forget during exam tension, you forget, you can always ask flaws. What is flaws? Do you have any fever? F, fever, lumps or bumps, or any lymph nodes that they can feel? Any anorexia, but you will not ask anorexia. In the main words, you would ask any change in appetite, any loss of appetite, any weight loss, any night sweats. Why are red flags important? Because they help you identify serious or life-threatening condition. And for examiner, red flags show that you are a safe, systematic, and thinking like a doctor. Once the main symptom and red flags are done, go for the background history. They will help you in assessing the risk factors relating to the specific condition that you're going to diagnose. So use the mnemonic PMAFTUSA. What does it stand for? P, past medical history, medications. You will ask if patient is on any medications. Or is he taking any new medications? Allergic, is he allergic to any food or any medicines? Then ask about family history, travel history, what is his occupation? Okay, now occupation is really important because this is a person. It's affecting his life. It might be affecting his daily work. And there are some conditions then during which are caused by occupation, such as is person exposed to asbestos, then it will help you in diagnosing the lung cancer. So you have to ask these things because every point in history taking is helping you towards making a diagnosis. You would ask about smoking, alcohol, and activity levels. This gives the examiner a full risk profile of your patient. So, sorry, I forgot to add before, but after red flags and before PMAFTUSA, if there's a female patient, you have to ask a very important section that we must cover. You have to ask that the 5 P's and 1 S. This helps us complete the gynecological and sexual history safely and professionally. So what is the 5 P's? Periods, pills, don't have any contraceptive pills. Then you have to ask about pregnancy. Is there any chance you could be pregnant? Ask, ask about partner. Are you in a relationship? Any new partner recently? Sometimes when there are conditions such as any STIs, so you have to keep it non-judgmental and neutral. You have to ask about do you have one partner or multi-partner? We will cover this in gynae or sexual transmitted diseases section. Then ask about pap smear. When was your last cervical screening? Was it normal? Ask about sexual history. So the next part is also important. It's psychosocial history, or you can ask about effect on life. This part is often ignored, but it's so important. You have to ask the patient, how is this condition, how is this problem affecting your life day to day? Is it affecting work, sleep, family, mood, all these things? So why is this important? It shows empathy. It helps you plan management and safety netting, and examiners also love it. Forgot to write here psychosocial history. In psychosocial history, it actually helps you understand the patient's life, stressors, support system, and impact of illness. Keep it gentle, non-judgmental, and empathetic. Ask, who do you live with? Do you have someone at home who supports you? And you can ask about family and relationships here. Now, let's go into ICE. What is ICE? It's really important. It will help examiner determine your interpersonal skills. So ICE means ask about ideas. What does the patient think is going on? Concern. What are they worried about? Expectations. What are they hoping you can do for them during this consultation? After that, you have to do examination. Then comes to diagnosis, give a simple non-medical explanation of diagnosis. And then comes the management. And that's it. This is the cleanest, safest, and most examiner-friendly history-taking structure for PLAB2 or any other OSCE. You can use it in every station and you will feel instantly more confident and organized.